So many families are needing help with their aging loved ones, but yet there's so much that we don't know about elder care. We have Kathy Rogers from Absolute Companion Care here. She is the perfect person to answer some of our questions. How are you, Kathy?
I'm well, Elsa. How are you?
I'm doing well as well. Thank you for being with us. Elder care, it is not one size fits all. And I know that that's a belief that you ascribe to at Absolute Companion Care.
True. It is not one size fits all. Neither is it the same plan from the moment your care begins to when it ends. In the beginning, we're going to have an RN come out and do a full assessment. We want to see what you need and what you don't need. We do not want to interfere with your life any more than has to happen so that you can get the help you need without having interruptions. Now, as that goes on, your care will change. Your needs change as time goes on. I just had a Zoom with 5 children of a client we're working with. Some weren't even in the US. We were able to put together a care plan and really discuss ideas and strategies that work with a dementia client. These tools that we have, we use those, and we use those to your benefit so that we always know that your care plan is appropriate for what your needs are at the time.
What a great idea, too, to be able to bring all the family together in that special way, near and far in the middle of a pandemic, just to make sure that their loved one is getting the appropriate care and the care that they would want for their loved one. Why do most elders prefer to have a company rather than just one caregiver that they hire themselves, a single caregiver?
Well, it's not uncommon for people to hire an independent caregiver. However, there are some tax laws and rules that will come into play. One of them is that if you pay an independent caretaker more than $2,100 in a year, then that person is no longer independent. They are now a member of your household staff. You, at that point, are regulated by the tax laws. You need to go and get a tax ID number. You need to pay federal and state taxes on that employee's income. You need to carry workers' compensation and disability insurance. There are a lot of little things like that that add up. In addition, when you work with Absolute Companion Care, we're going to take care of those things, as well as we carry all of their liability insurance. If you hire somebody independent, the liability insurance policies vary greatly. So that's something you really have to be on top of. Another aspect is, are you doing drug testing? Are you doing background checks? Are you keeping track of their driving record? All of those things come into play every year. When you have a company like Absolute Companion Care, you have an HR department who takes care of all of that for you and assures you that your caregiver is always in good standing. These are important things.
Absolutely, especially when we're dealing again with our loved ones. How do we know that we are finding a reputable company? How do we do our research and make sure that we're hiring the right company?
Well, the first place you want to start is at the Maryland Healthcare Quality. The Department of Healthcare Quality is our licensing agent. So you're going to be able to get a list of all the agencies that are licensed in the state of Maryland, and they list them by county, so it's not hard to find. But you want to make sure you've got one that is licensed. There are some out there that are not. So that's your first step. Then you also, read the Google reviews, read the Yelp reviews. Go to people you know who have had care in the past and ask their opinion. Another good place is Nextdoor. The Nextdoor website is people in your area. There's oftentimes threads of conversation that deal with having adult health care in your house.
Okay. And I'm also wondering, how long do you retain your caregivers? Because I hear a lot about turnover in the industry as well.
There is a lot of turnover in this industry, but right now hiring is more of an issue. And if you're watching the news, you've seen it. So our best goal right now is always to hold on to the caregivers that we have and to make sure that they're being treated well so that they stay. 67% of our caregivers have been with us 5 years or more. That's an important fact to know. You're not getting somebody who's brand new. We give them a 401k. We have health insurance when they're full-time. We leave the lines of communication open. Again, we use Zoom in order to talk to teams as a whole so that they are very aware of care plans. They know what the changes are. Communication is of the utmost importance. We want to make sure that the caregivers we send to you are fully vetted, are fully prepared, and are ready to step right in and provide the care that you need.
So what is the best way to connect with Absolute Companion Care?
Absolute Companion Care can be found on the web at www.absolutecompanion.com. You can always call us 410-357-9640. I'm happy to help in any way I can.
All right, Kathy Rogers, thank you so much for being with us. Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.